The talk of today is concerned with the anatomy of the Pterygoplatine fossa. The Pterygoplatine fossa is an important and small area present within the bones of the head and neck. The face and the head. Now, the Pterygoplatine fossa, as a definition, it is a cone-shaped space present deep inside the face, extend from the infratemporal fossa through what is called the pterygomaxillary fissure. So the communicating points or the canal between the deep pterygoplatine fossa and the infratemporal fossa is through the pterygomaxillary fissure. This cone-shaped fossa, as seen here in this illustration and diagram, the outer or the external communication with the infratemporal fossa, and this is the space of the pterygoplatine fossa, and then more deep on the medial aspect of the fossa, the nasal cavity present there. Now the fossa present bilaterally and located between the bones maxilla, sphenoid bone, and the palatine bones. We will come up to the boundaries of the fossa in the next slides, and we will see the relation between them. The volume of the fossa, the pterygoplatine fossa, it is a small volume, although we have an important structures within the fossa, and this will give its complexity regarding the anatomy of the fossa. The second important points about the pterygoplatine fossa is the boundaries of the fossa. You can see here the skull, and this is the site for the fossa deep inside here within the bones of the maxilla, of the sphenoid, and of the other bones. We will mention them as follows. Now, the anterior boundaries of the fossa is by the maxilla, so it is the posterior wall of the maxillary sinus, as seen here, the yellow one. The second point or the second boundary is the posterior boundary of the pterygoplatine fossa, and this is by the sphenoid bone, and more particularly by the pterygoid process here. Pterygoid process here of the sphenoid bone is more posterior. And the inferior boundary by the palatine bone and the palatine canal. The palatine bone, one of the bones that forming the hard palate. And the superior boundary of the fossa is by the inferior orbital fissure with the orbit. You can see here, this is the orbit here, and in this point we can found the inferior orbital fissure, which is the exit from the pterygoplatine fossa to the orbital cavity. And the medial boundary or the medial wall of the fossa, it is the palatine bone by the perpendicular plate of the palatine bone, deep inside here, more deep and more medial. And the lateral one is the pterygomaxillary fissure, which is evident here by this right circle. This is the pterygomaxillary fissure, which is the communicating foramina or fissure between the infratemporal fossa here and the deep pterygopalatine fossa deep inside right here. Okay, these are the main boundaries of the fossa from different sides, and now we can make it more simple by this illustration. The slides, the coming slides will explain the relations of the pterygopalatine fossa with the regions around it. For example, the pterygopalatine fossa has communication with the infratemporal fossa lies more external, more lateral through what is called the pterygomaxillary fissure, and this pterygomaxillary fissure will transmit the superior alveolar nerve and parts of the maxillary artery from the infratemporal fossa through the fissure and then reaching or entering the pterygopalatine fossa. So we have the posterior superior alveolar nerve that's supplying the upper jaw, and the terminal part of the maxillary artery, which passes through the pterygopalatine fossa. The second illustration or diagram will show the relation between the pterygopalatine fossa and the area in the cranial in the cranium, the middle cranial fossa, and through the foramen rotundum. There is a communication between two spaces or two regions, and then here we have the maxillary nerve, the V2 nerve part of the trigeminal nerve comes from the middle cranial fossa and through the rotundum foramina to reach or enters the pterygopalatine fossa. So the maxillary nerve is one of the contents of the pterygopalatine fossa. So there is a communication between the middle cranial fossa and the pterygopalatine fossa. You know that the middle cranial fossa is more superior in level to the pterygopalatine fossa. Now again, that middle cranial fossa communicated through another way by the pterygoid canal to reach the pterygopalatine fossa, and this canal will contain or contains the following neurovascular structures: the nerve, artery, and vein of pterygoid canal. They are named as such, and these nerves and vessels passing from the middle cranial fossa through the canal to reach the pterygopalatine fossa. Other communications in reverse way from the pterygopalatine fossa to the nasopharynx lies more medial, more deep, through what is called the pharyngeal canal, and this pharyngeal canal is the way of a transmission or transit of the maxillary nerve passing from the fossa to the nasopharynx, supplying the mucosa there, and the maxillary artery also, the terminal branch, may sharing in supply of the parts of the nasal cavity also present here. So through the pharyngeal canal we have the communication between the pterygopalatine fossa and the nasopharynx. The other points and other communications with the orbit above it through the inferior orbital fissure present in the roof of the pterygopalatine fossa, and this fissure transmits the following structures: the nerve called branch of the maxillary nerve, zygomatic branch, and the infraorbital artery and the infraorbital vein. In actual fact, these sharing in the supply of the floor and even the part of the face in the infraorbital part. So this is the communication between the orbital cavity and the pterygopalatine fossa, and these are the structures passing through this fissure. The other communication with the oral cavity. Now the pterygopalatine fossa has its communication through the greater palatine canal to the oral cavity, and via this canal we have the following structures. We have two nerves and two vessels. Two nerves, we have the greater palatine nerve and the lesser palatine nerve, and they are sensory in actual fact, and to the mucosa there in the palate, and the descending palatine artery, which is a branch of the maxillary artery, and the descending palatine vein accompanying the artery. These are structures passing through the greater palatine canal between the pterygopalatine fossa and the oral cavity, which lies more medial, more inferior to the pterygopalatine fossa. And here we have the important communication between the pterygopalatine fossa and the medially located nasal cavity through what is called the sphenopalatine foramen. And this foramen, it is the way of transmit to the sphenopalatine artery, very important artery that's supplying or sharing in the blood supply of the lateral wall of the nasal cavity and even the septum of the nose. So it shares in the blood supply, and it is regarded as one of the important sources of bleeding from the nose. Now the sphenopalatine vein also, it is another structure passing from the pterygoplatine fossa, from the nasal cavity to the pterygoplatine fossa in a reverse way, draining the blood of the nasal cavity. And the nasopalatine nerve, which is an important nerve, sensory, it is regarded as one branch from the pterygopalatine ganglia. And this nerve, it is a sensory, general sensory to the nasal mucosa. So the important relation between the nasal cavity and the pterygoplatine fossa is the passage of these structures, whether from to and through what is called the sphenopalatine foramen. Okay, we come to the contents and the major contents of the pterygopalatine fossa. We have we have two nervous structures and one maxillary artery. The maxillary nerve, which is the V2 nerve, branch of the trigeminal nerve, the fifth cranial nerve, is sensory. It is purely sensory. There is no motor component of the V2 nerve. And the pterygopalatine ganglia, it is a parasympathetic ganglia actually, although it is serving for some sympathetic function. We will come about that to explain it in a moment. And the maxillary artery, it is the main vascular contents of the fossa. Now, starting with the maxillary nerve. The maxillary nerve, by definition, it is a sensory second division of the trigeminal nerve, which is the fifth cranial nerve, and passing from the cranial cavity to the pterygopalatine fossa through what is called the foramen rotundum, lies here. And then we have this maxillary nerve within the fossa, and it will give many branches inside the pterygopalatine fossa. So the nerve passes, as we mentioned, from the middle cranial fossa to the pterygopalatine fossa via what is called the foramen rotundum. So this nerve, the main trunk of the nerve, will leave the fossa via the infraorbital canal and foramen, infraorbital canal and even foramen here present, to reach to the infraorbital foramen, and we can name it as infraorbital nerve, supplying sensory to the region of the face right here. So the nerve, maxillary nerve, as we mentioned, supplying sensory to the region present there by their branches. For example, we have alveolar branch, zygomatic branch, and also infraorbital branch. These branches of the maxillary nerve, all of them are sensory. Keep in your mind, there is no motor component here. We have, for example, the infraorbital, which is the one we explain it just in a moment, passing from the fossa through the infraorbital canal and then exit here through the infraorbital foramina as infraorbital nerves. It's sensory to the area here. Also, we have zygomatic branch, which leaves the fossa through the fissure, the inferior orbital fissure, and also supplying the area there. Nasopalatine also is an important nerve supplying the nasal mucosa, or superior alveolar nerve like this. These nerves supplying the alveolar process and also the teeth of the upper jaw. The posterior group of the teeth of the upper jaw supplied by this nerve, which is sensory. And also we have pharyngeal branches and then we have the greater and lesser palatine nerves also, and also we have the pterygopalatine nerves. These are branches from the maxillary nerve, and there are two nerves communicate the main trunk of the maxillary nerve with the pterygopalatine ganglia. You can see these are two twigs, 1 and 2. These are the communicating and hanging the pterygopalatine ganglia with the main trunk of the maxillary nerve. These are the main branches of the sensory maxillary nerve in the pterygopalatine fossa. The other contents of the fossa, we have what is called the pterygopalatine ganglia, which is the largest parasympathetic ganglia, is related to the branches of the maxillary nerve, although the main supply by preganglionic fibers comes from the facial nerve through the greater petrosal branch, which is the preganglionic parasympathetic fibers comes from the salivatory nucleus to reach the ganglia as a preganglionic fiber. So after synapse in the ganglia here, pterygopalatine ganglia within the fossa, the postganglionic fibers, parasympathetic, will serve as a functional parasympathetic secretomotor innervation to the glands, for example, lacrimal gland, and also the mucosal glands of the nasal and oral cavity. So the facial nerve will send a parasympathetic preganglionic fiber via the greater petrosal nerve and reaching the ganglia, and then the postsynaptic fibers passing to the area of effector, like the lacrimal gland, the nasal cavity, the glands of the nasal cavity and in the nasopharynx, and also the roof of the mouth. These are secretomotor. So the main function of the ganglia, actually it is the parasympathetic ganglia. Although we have some articles explaining that the ganglia have some sympathetic vasoconstrictor activity via the source of the sympathetic outflow from T1 to T3 spinal segments, and this will send its preganglionic fibers via the lesser petrosal nerve to reach the ganglia, and then postsynaptic fibers will pass with the branch of the arteries to the area there, supplying the vessels at the area here, and this will cause sympathetic supply and its function in the area. Also, the ganglia, by the branches, the 6 branches of the ganglia, will supply even general sensation of the region via branches of maxillary nerve. The maxillary nerve has its 2 twigs, as we mentioned just before. I will make it clear for you. The pterygopalatine nerves that are hanging the ganglia to the main trunk of the maxillary nerve. So by these twigs of nerves, we can say that the ganglia also serve for general sensation of the mucosa of the naso-oropharynx region. So this is an important ganglia, and even sometimes we can call it the sneezing ganglia, because the maxillary nerve, it is the nerves responsible for the action of sneezing. Okay. The other important contents of the last contents of the ganglia is the maxillary artery, which is a main or terminal branch of the external carotid artery. The terminal branch of the maxillary nerve, artery, will be seen in the pterygopalatine fossa. So the terminal branch of the maxillary artery will give branches inside the pterygopalatine ganglia, like the sphenopalatine artery, which is an important artery passing to the nasal cavity, and the other and as we mentioned, that the sphenopalatine artery is the main source of blood supply to the nasal septum and the lateral nasal wall, and responsible for most of the cases of the epistaxis, of the bleeding from the nose. And also the descending palatine arteries branch from maxillary artery, and this branch supplying the hard and soft palate in the oral cavity. And we have also the infraorbital artery that supplies the parts in the area of the orbital cavity, like the lacrimal gland and some muscles of the eye, extraocular muscles. And the other branch of the maxillary artery within the pterygopalatine fossa is the posterior superior alveolar artery, supplying the upper jaw, part of the upper jaw, and even the teeth in the upper jaw, supplying also the gum and gingiva of the upper jaw. These are branches of the maxillary artery, and in turn they are considered as the contents of the pterygopalatine fossa. You can see here in the diagram one of these branches. For example, the superior alveolar artery, like this, comes from the maxillary artery here, and also we have the sphenopalatine artery here passing deep to reach the nasal cavity, and also we have descending palatine and infraorbital artery here, infraorbital artery passing right here to reach the area and exit through the infraorbital foramen to supplying the region of the face around the orbital cavity. Okay, these are the main contents. As we mentioned, the maxillary nerve with its branches, which is purely sensory, and the pterygopalatine fossa, which is parasympathetic, sympathetic ganglia, very important in its function and supply. And the last content was the maxillary artery and its main branches. And now we come to the last slide of the lecture concerning with the clinical points. Most of us, we know that the bleeding from the nose called the epistaxis, and the epistaxis might be due to many causes. Most commonly it's the injury and laceration of the mucosa of the nasal cavity, and this will lead to bleeding from tiny arteries present there. This epistaxis, or bleeding from the nose, might be due to injury of one of these branches supplying the nasal septum or even the lateral nasal wall. But the main source of the bleeding from the nose is from the sphenopalatine artery, which is the sometimes we call it the artery of epistaxis. Now you can see here the sphenopalatine artery comes and supplying the lateral nasal wall and reaching to the anterior part of the nose, and also here the sphenopalatine artery send twigs and branches to supply the septum of the nose. And this area we call it Little's area or Kesselbach area, when we have anastomosis of many terminal branches of many arteries like ethmoidal arteries, anterior, posterior, and the sphenopalatine artery, and even we have palatine arteries comes near by and causing anastomosing channels here. This will be a risk area for epistaxis, and so we can control the bleeding sometimes simply by pressure on the area here for 4 to 5 minutes. This will be responsible for controlling the bleeding from the nose, or sometimes we can need a surgical approach to controlling the artery, the sphenopalatine artery, and ligate it to control the bleeding. So from simple cases to more sophisticated and complicated cases. So this is the clinical points related to the artery comes from the pterygopalatine fossa. I think this is the main important anatomical description of the Pterygoplatine Fossa, its boundaries and its contents, and also its clinical relevance. I hope you get the benefit, and good luck. Thanks and goodbye.